This cartoon details baclofen overdose, and in this particular cartoon we wanted to give a shout out for a parody to Don Martin from Mad Magazine, who had drawn a similar cartoon with the organs popping out on springs during surgery. And I think even Gary Larson, who did The Far Side, did a similar type cartoon. But I just want to emphasize that baclofen overdose is no laughing matter. Baclofen is a prescription skeletal muscle relaxant that induces a hypnosedative toxidrome when taken in overdose. It's a medication that's often used for the treatment of muscle spasticity associated with spinal cord injuries, cerebral palsy, and multiple sclerosis. It's available in pill form and is a liquid for the use in intrathecal pumps. To quickly review the hypnosedative toxidrome, if you've ever seen a patient that was heavily intoxicated on alcohol, they were exhibiting the symptoms and signs of hypnosedative toxidrome, as alcohol is probably one of the most common hypnosedatives that we'll see patients intoxicated on when they present to the emergency room. Just like baclofen acting as a hypnosedative, patient will present with confusion, amnesia, nystagmus, discoordination, ataxia, loss of bowel or bladder control, diplopia. They can have a decreased respiratory rate, some decreased heart rate, mild hypotension, and could be at risk for loss of consciousness, in which case supportive measures to maintain the airway would be indicated. In baclofen overdose, there was a case report about 14 teenagers at a high school event appeared very intoxicated several hours after the event started, again exhibiting symptoms of hypnosedative toxidrome, including discoordination, ataxia, slurred speech, nausea, vomiting, that then progressed to somnolence, coma, and apnea. 2 of the teens unfortunately died of a respiratory arrest. 8 of them required mechanical ventilation for several days. They did search through the various teenagers' possessions and clothing and found one of the girls had in her possession a baggie filled with baclofen pills. Also, another case report that occurred in Syracuse, New York, was a patient had overdosed on baclofen, but it was unknown that the patient had overdosed. The patient was then started on supportive measures, airway, breathing, circulation, put on ventilation, respiratory support, cardiac monitoring, and after several or 8 days, the patient was declared brain dead. And as they were actually preparing to harvest the patient's organs for transplant to another patient, the patient started to show some signs of higher brain function. The transplant harvesting was aborted, and the patient ultimately recovered. Again, the signs and symptoms of baclofen overdose are going to be very similar to the hypnosedative toxidrome: CNS depression, discoordination, ataxia, nausea, vomiting, slurred speech, meiosis. With baclofen overdose, hypo or hypertension, bradycardia or tachycardia. Naturally, as a muscle relaxant, it's going to cause muscle relaxation with diminished reflexes, and as the ingestion progresses or as the toxidrome progresses, patient's going to exhibit signs of decreased mental status, coma. They can potentially have seizures, have respiratory depression, apnea, then cardiac arrest. In some cases, there can be paradoxical muscle contraction, and doses of baclofen in overdose greater than 200 milligrams are the ones more commonly associated with seizures, coma, and prolonged ICU admissions. The mechanism of action of baclofen is as a GABA B receptor agonist, and again, anytime a patient is on chronic GABA agonists, the abrupt discontinuation of that medication can cause seizures and withdrawal syndrome similar to that of alcohol or benzodiazepines. Again, treatment's going to be supportive: airway, breathing, circulation, fluid resuscitation, cardiac monitoring. Things to know as far as pearls is baclofen is becoming increasingly used as a drug of abuse because it induces euphoria at higher doses. It acts as a hypnosedative similar to alcohol. And if the drug is administered intrathecally, only smaller doses of the drug are required for desired effect. Thus, you'll see patients that have the baclofen pumps to help control their spasticity.